Hello, I'm Mike Sterling. I'll be your student physical therapist today under the direction of Dr. Wright. Um, is Serena, is that how you pronounce your name?
Yes.
Serena? Um, well, it's good to meet you. First off, I just want to make sure, are you by yourself? Or is there a family member with you?
Husband.
Your husband's with you, okay. Just want to make sure that you're comfortable with me treating you, or if there's anything that I can do to help make this process more comfortable, you can just let me know. Or if there's anything that you don't understand, just ask me to clarify. I'll try to ask, I know that you understand English fairly well,
Yes.
but it's coming up with the words may be tough, so if you need me to rephrase anything, just let me know. But I'll try to ask lots of yes or no questions.
Okay. Thank you.
You're welcome. So, I can see that you broke your arm. Can you tell me a little bit about what happened, or describe a little bit? I understand you fell off a ladder.
Mm-hmm.
Okay.
Husband and I own a walnut tree farm.
Okay.
And I just lost my balance and poochum, fell off.
Fell. Okay. Did you fall with your arms straight,
Oh yeah.
or did you fall kind of? Did you bring your arm in when you fell?
I don't remember.
Okay. No problem. And just so you know, I'll be just referencing my notes here, just to make sure we cover everything and we can give you the best care possible.
Okay.
So I understand. I mean, your elbow hurts still, correct?
Yeah.
And you have pain in your hand and in your back. Is that correct? Can you describe that pain for me? Are you able to do that?
Oh, it is a very in my neck and my back. It just feels tight and I don't know the words.
Okay. Tight is a good way to describe it. What about the hand and the fingers?
I just can't feel it as much. It feels weird and like needles.
Okay. I can understand that. So you kind of feel pins and needles a little bit, some numbness and tingling. Okay. We will address that. Currently, if you were to rate your pain from 0 to 10, 10 being no, or 0 being no pain and 10 being worst pain imaginable, what would you rate your pain in your elbow currently?
Oh, I think a 5.
A 5?
Yeah.
And what
maybe
about
a 4?
Okay, what about the back and the neck?
That would be a 5.
A
little
5.
bit more. Yeah.
Okay. And the fingers, do you have any pain there, or is it just numbness and tingling?
That would be 5.
A 5?
Yeah.
Okay. Does it get any worse than that? Is it ever worse than a 5?
Either
one of the spots?
Yeah. This is probably the best it's been.
Okay.
It gets to be about an 8 out of 10.
Is that your back and neck, or your elbow, or your fingers?
All of it.
All of them?
All of it.
Okay. What makes it worse? What makes it get up to an 8?
When I'm not wearing my sling.
Okay, so when you have your sling on, it kind of helps the muscles relax a little bit. Okay.
Or, well, no, it hurts. It hurts more when I don't have it supported.
Okay. So when you wear your sling, it's better?
Yes.
Okay.
Yes.
Alrighty. Do you know if you hit your head at all when you fell?
Yes. Yeah. I don't think I have any brain injuries.
Okay. So when you went to the hospital, correct?
Mm-hmm.
When you went to the hospital, did they examine your head and your brain and take pictures of that at all?
I don't know.
Okay.
Yeah, I don't remember a lot of
Okay.
that.
Does your husband, does he remember?
No.
Okay. Alrighty. Well, we'll make sure to look at the neck too.
Okay.
Do you remember losing consciousness?
I don't think I did.
No? Okay. Have you felt dizzy since, like you feel like you're gonna fall over?
No.
Okay. And I see that you marked on your intake form that you've been feeling upset in your stomach, so nausea.
Yeah, I think it's just the stress of everything. And
Sure.
yeah,
Is there anything that causes that to be worse?
just increase in pain.
Okay.
Yeah, when it hurts, it makes me feel sick to my
Okay.
stomach.
Are you taking the medication that the doctor gave you? I see that you marked that they gave you Percocet.
Yeah, I'm almost out of it.
Okay.
But yeah.
Okay, if that is what's making you feel sick, or you feel like it's not working or working too well, I would discuss that with your doctor.
Okay.
That's not something that I will deal with, but
It can cause upsets.
it can, yeah, sometimes did your doctor tell you to take it with or without food at all?
With food.
With food. That could be contributing to it.
Okay.
But those are better questions for him. I don't have all the answers in terms of medication,
Okay.
but alrighty, let's see. I also see that you marked that you have a history of breast cancer.
Yes.
You had surgery for that. How long ago was that?
It's hard to say. It could be 5 years, could be 10, but somewhere around there.
Okay, it was a little while ago.
Yeah.
Do you know how often do you get checked by your physician, by your doctor for breast cancer? All the time?
All the
Okay.
time.
That is good. Continue doing that just
Yes.
with with your age and history, it's something that you just want to be very careful with.
Yes.
Alrighty. And you have problems with sleep?
Yes.
Not able to sleep very well?
When the arm hurts, I wake up sometimes, and sometimes I just have a hard time getting comfortable.
Okay.
But when I do, I sleep.
Okay. Are you able to I lost my question. Alright, I'll cut that out. I don't remember the question. Okay. So describe for me, I understand that you worked as a walnut farm, correct?
Yes.
How is that? Does that require a lot of physical effort? Are you moving around a lot
Yes.
during the day?
Yes.
Okay. Is that your main source of physical activity? Are you doing any exercise on the side?
No time.
No time. Okay.
Just taking care of the trees
Sure.
and the farm
Yeah.
and the business.
That can be a lot of work.
Yeah.
I can understand that.
Yeah.
Okay. Other than that, will you kind of, if you're able to, describe kind of your day-to-day activities outside of work? Like any work around the house or other things that you will be doing around the home?
I play guitar.
Okay. Are you right-handed or left-handed?
Right.
Right. Okay.
Yeah. But I'm not able to do that right now.
Sure.
For good reason.
Mm-hmm.
But I also sing. I love to sing.
Okay.
And play with my grandchild.
Okay. How old is your grandchild?
I believe he's only 2 right now.
So really small.
Yes.
Okay.
Yes. But very, very cute.
I can imagine. Okay. Any other things?
No.
Okay.
No time.
Alrighty. Yeah, you're too busy with the walnut farm.
Yes.
I can understand that. Okay, so what kind of things are you hoping to get back to?
Oh.
Or goals, if that's a better way to
I just want to be able to get back to work and do all my stuff again and use my arm.
Okay.
Yeah, and get rid of the pain.
Sure. Okay. Let's see. So I'm just gonna ask you a few questions. You can just answer yes or no.
Okay.
If you don't understand, just I can rephrase it for you. Okay. Have you had any unexplained weight loss or weight gain?
No.
Okay. Any fever or chills or sweats?
No.
Okay. And I understand when you sleep, you have pain, but you're able to relieve that pain with changing positions,
Yes.
correct? Other than that, you don't have any pain at night?
No.
Okay. And you said you've had some nausea and vomiting. You felt sick to your stomach a little bit.
Yeah.
But that's not all the time.
No.
It's
No.
comes and goes with the pain and kind of the stress day to day.
Just since injury.
Okay. And you haven't felt dizzy or lightheaded at all?
No.
Have you fallen over since you've had your injury?
No.
Okay.
Just the one time.
Also, real quick, do you know what caused you to fall off the ladder?
Oh, I was just reaching up really far, and there was some spider webs up there that I was
okay.
trying to get rid of.
Okay.
And I just go plop backwards.
Gotcha.
Just
Kind of an
lost my-
odd position.
Yes.
Okay.
Yes. Not normally in that.
Okay. Have you had any fatigue? Have you felt tired out of the ordinary?
Oh, not too bad, no.
Okay. I mean, I understand that you have a pretty physically demanding job, which will make you feel tired, but anything outside of that would be raised for concern. Any weakness that you've noticed through your arms or legs?
Just the arm.
Okay.
Yeah, just hard to move.
Okay.
I mean, it's not too bad, but mostly in the hand, I think, is hard to move.
Gotcha. And you have the numbness and tingling in the fingers. Do you have numbness and tingling anywhere else?
No, just in the fingers for
Okay.
that.
And then have you noticed any changes with thinking or memory, anything like that?
No, I don't have good memory to begin with, but that's just how I've always been.
Okay. Alrighty. Have you had you didn't mark that you have any heart conditions, but do you have anything other than, is there anything other than what was on the form? Do you have any issues with the heart or your blood pressure?
No.
Okay.
No.
Have you had any trouble breathing?
No.
Since the injury? Alright. And when you fell, I understand that you broke the elbow, but did you have any scrapes or any bruising that has not healed since then?
It was a little bruised and a little bit because
Okay.
I fell on branches, but I haven't been able to see it since it's been in the cast.
Under the cast?
Yes.
Okay. Any bruising up on the shoulder or on the side at all?
I don't know.
We can take a look at that.
Okay.
Alrighty, is there anything else that we haven't talked about that you feel would be good for me to know medically before we proceed?
I don't think so.
Okay.
I will think about it.
Okay. So your husband is here. Will you describe a little bit about your situation at home? Is it just you two at home, or do you have any other family there?
I have 3 daughters.
Okay.
Only one of them lives with me.
Okay. And how old is that daughter?
She is in college.
Okay, older.
Yeah.
Okay.
And but my other 2 live close by. But yeah, they are out of college.
Okay. And as I understand, I mean, the business you and your husband own, it'll keep you pretty busy. I mean, if he's not able to help you with any of the activities around the house that you may need help with, is your daughter able to help you with those?
Oh, I believe so. I'll have to talk to her. My
Okay.
husband's very busy,
Sure.
so yeah.
Okay.
I can ask.
All right. Yeah. I'm thinking of just like cooking and cleaning, possibly any bathing, just because you don't want to stress that arm too much.
Yes.
That may be stuff that is difficult for you to do that would be beneficial if you had some help. So if you would talk to her, and we can visit that at another date.
Okay.
Okay, so now I'm just going to take the vitals of the patient before we get going. Okay, are you okay if I place my hand on your shoulder and your arm?
Yes.
Okay.
Yes.
Do you had your blood pressure taken before?
Yes.
Okay, so you kind of know what to expect. Ninety-seven over 70. Is that pretty normal for you? Okay, so now what we're going to do, we're just going to look at some of the motion of your arms and your neck. Are you okay with that?
Yeah.
Okay. So first what I'm going to have you do, you can just look at me. I'm going to have you bring your head to your ear to your shoulder.
Ooh.
What do you feel there?
Very tight.
Very tight. Where is your tightness? Can you point to it?
Yeah. Just.
Okay, kind of through that neck area.
Yes.
Okay, can we go
But
to
it
the?
feels good.
It feels like a stretch.
Yes.
Okay. Can you go to the other side?
Yeah, that hurts.
Okay, what hurts?
It hurts my neck and my shoulder.
Okay. Do you feel like it goes down your back at all, or kind of into the front of the shoulder?
The back.
The back.
Yeah.
Alrighty.
I think I feel more needles.
You kind of feel it in your fingers a little
Yeah.
bit. Okay.
Yeah. What does that mean?
Well, all the nerves to your fingers, they come out of your neck. So if your neck isn't moving too well, it could be, it's just that it's trapping those nerves a little bit, which is not a serious issue. It's very, very treatable. We can definitely take a look at that.
Okay.
So I'm just going to place this on your head. We're just going to take some measurements, okay?
Okay.
Okay, so what I'm going to have you do, I'm going to have you bring this ear to this shoulder for me.
Okay.
Right. 27 degrees. And then we're going to go, yep, right there. And then we're going to come back to this side. Good. 20 degrees. All right. What I'm going to have you do, I'm going to have you bring your chin to your chest. Can you bring it straight down? Any pain there?
It's just tight.
Just tight, okay.
Just,
Can you bring your, and look straight up?
yeah.
What do you feel there?
I don't really know. It's still maybe a little bit of pain, but not as much.
Okay, any change in the sensation in your fingers?
No.
No? Okay.
No, just pain.
So same thing, I'm gonna measure that, I'm gonna have you do it again.
Okay.
Alright, and bring your chin forward. Good. 25, and come up to normal. And go backward. Alright. 29. is I just want you to rotate to look towards the wall.
Cool.
Pain there.
Yes.
Okay. And where do you feel in the neck?
Yes.
And what about the fingers? Anything in the
The
fingers?
fingers a bit.
A little bit?
Yeah.
Okay. Let's look the other way. Any change there?
Just a little tight.
Little tight? Okay. Any change in the fingers?
No.
Okay. Okay, go ahead and look to your left, or excuse me, yeah, to your left, look towards the wall. Alright. 35. And then look straight ahead for me. And look to your right. 39. Alright, so I'm going to have you with this arm. I just want you to bring it up. Can you bring it up? You can even go straight. Any pain there? Bring it up as high as you can.
Yeah.
Okay. Can you come forward for me? Anything there? No pain? What about backward?
No pain.
Okay. We're going to try to do the same with this. And if you need help because the cast is too heavy, just let me know. Or if it hurts too much, let me know, okay? I'm going to have you just come up as high as you can.
Okay.
Does that hurt at all?
It's just a little hard with the
It's
cast,
hard.
but maybe a little pressure in my neck.
In the neck, okay. Can we come forward? Any pain with that?
No.
Okay. What about backward? Yeah, we can move the chair if we need to. Any
No.
struggles with that one? Okay. Or I'm gonna hold your arm, and I'm just gonna help move you through, and you just relax, okay?
Okay.
Any pain there?
No.
What if we? What about there?
No pain.
Okay. Anything there?
No.
Okay, and then backward.
Nothing.
Any issues there? Okay. I'm gonna have you. Can you bring your arm straight up for me as high as you can? Is that as high as you can go?
Yes.
Okay. 155. 162 with overpressure. Okay, you can relax. Can I have you scoot forward in your chair just a little bit? Good. So what I'm going to have you do is I'm going to have you bring it all the way up to the side, and you can keep your arm at an L if that is easier.
And just go all the way?
Yes. Perfect. Any pain there?
No, not too much, but
Okay.
a little bit.
A little bit of pain?
Yeah.
Okay. 163. 165 with overpressure. All right. So what I'm gonna do, I just want you to, we're gonna play with the fingers a little bit. I want you to try and squeeze my finger.
That is hard.
Okay. Why is it hard? Are you able to describe why it's hard?
Maybe because I don't move it so much. I don't know.
Okay. Does it hurt?
No.
So I'm gonna try and I want you to hold your fingers straight like this. Good. I'm gonna try and pull. Is that pretty tough?
It's a bit.
Okay.
Yeah.
Does it hurt at all?
No.
Okay. I want you to hold them like this again. I'm gonna try and push them in. Don't let me move them in. Any pain there?
No.
Okay. Just a little difficult.
Yeah.
Okay. Alright. You know what? Can I have you curl your fingers all the way in for me? And what about, can you make them straight? Okay. Okay. So I'm just going to assess some of the bones in your neck and kind of how your neck's moving. Are you okay with that?
Yes.
Okay. So I'm going to place my hands just here on the side. Sorry if I pull your hair.
That's okay.
And you let me know. I'm just going to feel some of the bones if it's uncomfortable at all or if your pain gets really high.
Okay. It is very little tender.
Little tender?
Little tender. Yeah.
Is it more sore or painful?
I don't really know.
Okay.
It just, yeah.
I'll be gentle. I understand it probably is pretty painful.
Yeah, it was quite scary.
Yeah, that is understandable. And what about here on the sides of your neck? How does that feel?
It's a little tender.
Tender. All right.
That kind of hurts a bit.
It hurts a little bit.
Yeah.
Okay, I will be gentle. I want to go down to kind of see what else is hurting too.
Okay.
Does it hurt more up at the top or all the way through?
I think it just hurts everywhere.
Okay.
Yeah.
So I'm gonna have you scoot a little bit down towards me. Are you okay with that?
Yeah.
Alright. And what if how about to that side? Does that feel the same?
No, that's okay.
That's okay.
Yeah.
So pain in the cervical spine with lateral glides to the left, but no increase of pain with lateral glides to the right. So what I'm going to have you do, I'm going to have you tuck your chin into your chest like we did before. Good. And I just want you to hold it right there. I'm going to move my hands. I want you to hold it. Hold.
Ooh, it's so hard.
Yeah, it's not an easy one.
Ooh.
Okay. That's alright. You can just relax in my hand.
Okay.
That was pretty tough.
Yeah.
Was it painful at all?
No.
Okay. And have you had any headaches since the fall?
No, just pain in the back.
Okay.
Yeah.
Do I notice any increase in muscle tone kind of through the okay. So through the suboccipitals, paraspinals, upper trap, anything specific or just kind of widespread?
More so muscle guarding than anything.
Okay. So increased muscle guarding through suboccipitals, upper paraspinals, upper trap as well. Okay, I'm gonna have you roll over on your stomach. Are you okay with that?
Yes.
I'm just gonna give some pressure. Are you okay just to let that arm down to the side? So hypomobile through the cervical spine and into thoracic. How does that feel? Feel okay or is it hurt?
It's not as bad.
Not as bad, okay. How's the mobility of the segments through the thoracic?
It's alright, it's normal.
Okay. Normal through the thoracic spine. Any pain through just feeling around the shoulder here?
On the right side?
Yeah.
Just a little bit of pain down below the scapula.
Okay, so down here.
Yeah, just kind of right there.
Alright.
Medial border of the scapula.
Medial border scap, okay. Any increase in muscle tone? Or guarding?
No.
Okay. So increase of pain around medial border of the scapula, no increase in tone. Okay, I'm gonna have you go ahead and sit up for me. good. I'm just gonna have you face the wall. So I'm just gonna do a couple of tests. They may bug the neck a little bit, but I'm looking for any change in how your fingers feel, okay? So you let me know if your fingers feel any different, if they feel worse or better or no change.
Okay. Okay.
So I'm just gonna give a little bit of pressure here.
Oh yeah, and I feel it in my fingers.
Okay.
Yeah.
You feel more
Yeah, just a little
numbness
bit
and
though.
tingling. Okay.
Just a little bit.
And if I were to come over here,
Oh yeah. Okay.
you feel it right there.
Yeah.
Okay.
Yeah.
And I'm just gonna lift a little bit. Does that feel better, worse, or no change?
Oh, I mean, I don't feel it anymore.
A little better.
Yeah.
Okay.
It's still there, but not as much.
Okay. So what we're gonna do, just to address because of that, the nerves kind of coming out of your neck are affecting the numbness and tingling in your fingers. We're just going to. Sorry if I'm pulling on your hair.
Oh, okay.
We're just gonna give a little bit of traction here. How does that feel?
It feels good.
How about the numbness and tingling in the fingers? Any change?
It seems to have decreased.
Okay. So we're just gonna hold it here for a second. For a few minutes actually. Do a couple rounds. Alright, come off. Again. I'll be fast forwarding this part, but as the patient, do you feel like, how's my hand placement? Is it uncomfortable at all, or?
Oh no, it's fine.
Okay.
I like try not, because I think I remember when we were doing this, well, I don't know if it was this, but sometimes we like cover the patient's ears, and I know Rocco has like a huge fear of that, so it's
Gotcha.
like, and I use them for everything, so I like try to learn ways to go
To
around.
not do that. Yeah, I agree. It's like, it doesn't bug me that much, but it just like feels weird when my ears are covered or if they're like folded over.
Yeah. For him, he just doesn't like things in his orifices, is what he says. Like, he doesn't like his belly button touched, and he doesn't like things going in his ears. Like, he hates when people try to do like what Will is.
Yeah. That's understandable.
And
It's a weird thing that we do.
I know. And like,
even what willies or like
stick your
like
finger into someone's yawning mouth.
Yeah. Oh, my wife hates that.
Yeah.
Okay, so how does that feel after you've done that for a few minutes? How does that feel on your fingers? Any different or any worse?
Yes. It seems a bit better.
Better? Okay.
A bit better.
So what I'm going to do, I'm going to give you an exercise for you to do at home. We're going to practice just bringing that chin to your chest. Yep. Kind of like you're making a double chin. You know what a double chin is?
I'm good at that.
So I want you just to bring your chin in and do a double chin.
Okay.
Hold for a second or two and then relax. Good.
And just do that.
Mm-hmm.
How many?
So we're going to do 10. Just start with 10.
Okay.
We're going to do that 3 or 4 times a day.
Oh. Okay.
So I'm going to give you a couple exercises, and you can just do them all together. You don't have to space them out. So when you do them, let's do 4. We're going to do 4 sets of 10. Good. Couple second hold and relax. And you can just take breaks as needed, okay?
Okay. It's very tiring.
Yeah, it's a tough one.
Okay.
Good. Alright, so we're going to go ahead and sit up for me. And you can face the wall. So the next exercise we're going to do, this is another one we'll do at home, and just 4 sets of 10 of them, is what I want you to do is can you raise your shoulders up? And then I want you to go backwards, and then down, and then forwards, kind of like a circle.
Do I stop at up?
So go up, back, down, and forward. And that's one. So kind of like a circle. Good.
Okay.
How does that feel?
It feels fine.
So we're going to do, I want you to do six circles backwards.
Okay.
So 1, 2, 6 of those.
Okay.
And then I want you to go the other way. So we're going to go back, up, forward, down. So we go circle backwards and circle forwards.
Okay. And 6 times?
6 times, yep. So 6 backwards, 6 forwards, and do that 4 times a day as well.
Okay.
And I will print out a sheet that has all these written on there, just so you can refer back to it. I understand it's a lot of numbers to remember. It may be difficult to remember. So we'll just start with those 2. We did a little bit to help relax the neck, and then just retraining those muscles to work a little bit better. That'll be really important to getting that neck pain gone, and then just helping your shoulders move a little bit smoother. And when your next appointment, we'll do some more exercises on strengthening those shoulder muscles.
Okay.
But just getting that motion backwards and forwards will be good to kind of help turn those muscles on.
Okay.
Any questions about that?
When do I see you next?
Well, we can talk about that here. I'll give you your chair back. So right now, you're going to have the cast on for 6 weeks. So initially, I want to see you for those 6 weeks just because there's a lot of work we can do with the neck and the shoulder, and getting the finger sensation back. So I would want to see you 2 times a week if you can do that for 6 weeks. And then after the cast is off, I want to see you for another 6 weeks just to get that arm back to normal.
Okay.
So tentatively 2 times a week for 12 weeks, but we'll reassess as we go to kind of see where we are and the progress we're making, especially with the arm. But yeah, initially we'll start with the neck and the shoulder, and then once we get the cast off, we'll do some elbow stuff and some more of the wrist.
Okay. Do I get to work with this arm?
Yeah, so what I'm seeing right now, you know that you fractured and dislocated your elbow.
Yes.
I think because of the fall, you had a lot of muscle tension. Your muscles are really tight, and it's not allowing you to move super well, which I think could be causing some of that numbness in your fingers.
Oh, no.
Just because, the neck is a very fragile area, and if it's not moving super well, the nerves don't function properly. Luckily, that can be a very easy thing to fix, and we'll be able to address it if that's what's going on. But yeah, I think you'll definitely be able to work. I would definitely limit any time on the ladder. I don't want you on the ladder right now, just having one arm.
Yes, I don't want to. I don't want to be on ladder.
Yeah, but you can work just from the ground to kind of do what you need with this arm, but wear the sling as needed. I would try to wear it pretty frequently while you're working, just so that your shoulder and neck aren't bugging you as much.
Okay.
But when you're at home resting, let's go no sling, and you can do your exercises that I'll give you during that time.
Okay.
All right. Do you have any questions for me?
No. I don't think so.
Okay.
No.
Well, it's very good to meet you. We will see you. I'll have the front desk schedule you for your next visit, but we will see you later on this week.
All right. Thank you very much.
Great. Thank you. There we go.